Hey guys, this is Ryan from Strive Labs with this week's Tuesday tip. We are going to cover how you can use the Net Promoter to start to manage customer retention, or how you can start to identify people who are at a high risk of dropping out and intervene appropriately. If you haven't checked out our last Tuesday tip on just an overview of the Net Promoter, you can kind of click over somewhere in this area, find that link and watch it because it gives a nice overview. So what we know about physical therapies is about 20% of patients who come in the door drop out. There's a huge retention problem in PT. And that 20% that drop out are dropping out within the first 3 visits. So knowing that, we can use the Net Promoter to start to identify those people early on. Because what the Net Promoter says is people who score in the detractor range, or that 0 to 6 range, are far more likely to defect than people who score in that 9 to 10 or the 7 to 8 range. And a lot of the early data that we're collecting in physical therapy is kind of showing that statistic is holding true as well for our Strive Hub customers. So really what you need to do then, if these patients are dropping out early, is we want to deliver the Net Promoter early on in care before they drop out. So we can give you that data to understand who's at a high risk so you can intervene appropriately. So really what we want to do, again, and this is an overview of what the Net Promoter looks like, but you can utilize something like Strive Hub to automatically deliver the Net Promoter early on in care. And for us, best practice, we say, is probably about 7 days after their initial evaluation, where they have at least a good indication of what their experience has been like at that point. And that Net Promoter survey can come and hit their primary inbox, where it's just how likely is it that you would recommend to a friend or colleague. And let's say this patient Kyle is unhappy and they score a 4. Best practice for Net Promoter says, okay, let's get some qualitative feedback about why they scored the way they scored. So maybe Kyle says, my therapist stinks, and hits update response. So now automatically what we're going to do is we're going to shoot an email off to the right person in your organization. You can kind of choose who that is, where we'll say, hey, listen, you have a low survey submission that just came through the pipeline, and once you click in and log in, you're going to hit this page specifically, right, where we're going to say, great, this patient is Kyle Tildesley. He scored a 4. His primary therapist is Ryan Kleps. He's at our Boston clinic, and he's a neck pain patient. So now, essentially, what you should be doing at this point is you have the data at hand. The patient just started care a couple days ago. Now you can go ahead and either reach out to Ryan Kleps or reach out to the clinic supervisor at the Boston clinic and put a specific intervention in place to rescue this patient. We've actually kind of followed this with some of our customers and seen that they've had good success at decreasing early dropouts by identifying them early. One of our customers decreased early dropouts by about 20%, it's a pretty big deal. So really what we're looking to do is give you that data at the point of care and then allow you to intervene as you want. So again, I think as we were going through, we talked about how Strive Hub can help you automate this entire process and give you the right data at the right time. However, you can utilize other tools like SurveyMonkey and MailChimp to deliver this, or you can deliver it right in clinic. Get that information and just create a simple spreadsheet to track it and do it all on your own. So if you guys have any questions overall, you can reach out to us on Twitter at @Strive_labs, or email me specifically ryan@strivelabs.com, and I'll be happy to chat with you about the NPS. Be on the lookout next week, where we're going to continue to cover the benefits of Net Promoter, specifically in physical therapy.